Dorothy Moore. I'm one of the faculty at San Jose State Valley Foundation School of Nursing. I'm the coordinator for the FNP program, and I am also the graduate coordinator, so I'm managing the nurse educator program. So let's see. The first thing I want to say is, if you're interested in applying to this program, you should take some time to interview an FNP or to shadow one so that you really have a good idea of what the role is. Sometimes people apply and kind of get into it, and then they sort of realize, oh, this isn't what I thought it would be. This is not what I was looking for. And the slots are so precious, you know, we want to make sure you're in the right place. So when you write your statement for your application and you do a little video, if you can kind of address the fact that, you know, you have worked with an FNP or interviewed one or shadowed one or done something to give us an idea that you really understand what the role is, okay? So, you know, basically FNPs, family nurse practitioners, you're being trained to provide primary care care to the whole healthcare, the whole lifespan, right? From children all the way to older people, geriatric. Okay, so the admission criteria for our program, you need to have a BSN, 1 to 2 years of nursing experience, and we prefer acute care experience, and we even more so prefer something in a critical care area like ICU or ER. You also have to have a California RN license. So if you're out of state and you're not an RN in California, we can't accept you. And that's just a feature of our accreditation. So we admit people for the fall. So people for this year would be starting in late August. The program's 5 semesters. There's no kind of admitting people in the middle of the year or that sort of thing. We aim to admit about 20 students. I guess this is redundant, and that's redundant. We already talked about that, okay? And then this is just a little slide that goes over what your schedule might look like. And we've moved all of the courses online, except for there's a health assessment class you take your first semester. And that one has some in-person days because you can't really do health assessment very well remotely, although some schools do a good job of it. But for that one, you'll come into the lab. But classes are always on Tuesdays from 4 to 9 p.m. And they're kind of a variety of online stuff, lectures, readings, and then synchronous Zoom sessions. Like this is a synchronous Zoom session, right? So, and so the 3rd semester is the summer semester, and that's when you start your clinical hours. And in the 4th and 5th semesters, you're mostly doing clinical hours, but you're taking something called nursing theory at the same time. And you're also working on your master's project, which is like a 25 to 30 page paper that's a literature review on a topic of your choice related to nursing. And so this is just a layout. This slide deck, by the way, is on the San Jose State Nursing website, so you can download your own copy. This is just an overview of the actual courses you take. And we looked at that. This is a sample schedule. It's a little busy, a little hard to read, but basically the idea is like on some, let's say Tuesday, September 3rd, you have some work online for this policy class, but for these other 2 classes, you are having a synchronous Zoom session, okay? And on it goes for the rest of the semester. And in the clinical hours, it's a total of 540 hours. what can I say about that? That's the minimum direct patient care. We try to get you doing, let me see, about 225, that would be 450 plus 50. Yeah, I guess that's 500. So that's the minimum. And then we try to have some other activities, x-ray workshop, suture workshop, as we can get those people in to do those types of workshops. The clinical placements, okay, this is the hard part about running this program. These clinical placements are super, super hard to manage, to find. We would admit a lot more people if we could find more clinical placements. So when you accept, if you're admitted and you accept, that you're going to start the program, you really need to be very flexible and willing to travel to different locations as far as 50 miles away for your clinical placements. And that's just the way it is. We're competing with UCSF Medical School. We're competing with Stanford's Medical School. We're competing with UCSF's FNP program, USF's FNP program, et cetera. And those schools can afford to pay the preceptors as instructors and all this kind of things. So it is hard. The other thing it's very helpful is if you know of people who can precept you, that's really helpful. You're not required to do that, but the preceptors can be MDs, FNPs, or PAs. This is I hope, updated estimate of costs for the whole program. And this is how you apply. You do, oh golly, you do it through the, it's called the, you do it through the graduate application portal. It's just one application, and this is not true anymore because that was from last year. But it's probably going to close about March 1st, maybe earlier. We're getting quite a few applications. So you go, this is what I was thinking about. You go to this URL, it's Cal State Apply, and you select the correct program, which is San Jose State FNP. And there's a $70 fee, and submit your transcripts. If you went to San Jose State, that's a help because it's pretty easy to get the transcripts. If you're a foreign educated student, you have to submit this TOEFL thing and a transcript evaluation. And the graduate education office can help you with that. I am unfortunately not super versed on all of that. And so in the application, there's a personal statement. We want to hear what your goals are, why you're applying to the program, and what you're bringing to the program. And then we also ask people to create a 3 to 5 minute video that they post to YouTube, describing your nursing experience and why you want to be an FNP, and kind of talking to the fact that you understand what the role is. And then we also need 2 letters of reference. I'm noticing with the applications I'm getting now, a lot of people aren't using letterhead. They're just sending blank pages. So I don't really know, who the person doing the referring is. It could be your next door neighbor. So it has to be on official letterhead with the person's title, saying how they know the person and all of this. Okay, so that's spelled out. And then August is when the program starts. I want to say August 16th, but I'm not sure. Okay, and I think, let's see, other things you need to think about. You need to buy malpractice insurance. It's somewhere between $100 and $200. You need to have health insurance. Some of the clinical sites, I'm not sure which ones, but sometimes they've required background checks, and that's above and beyond what we are requiring. Of course, you have to transport yourself to the clinical sites. Yeah. So more information can be found on our website. And that is that. Wasn't that quick? That was quick. Does anybody have any questions? Wow, a quiet group. A quiet group. Well, if you don't have any questions, Happy Friday, and you can email me. I'm Dorothy Moore. It's dorothy.moore@sjsu.edu. And I'll stay on for a couple more minutes, just in case you're shy or something. Senna. Our FNP and nurse educator courses for the first year are different. Oh, I'm so sorry to report this. Unfortunately, we can look into it, Senna, but they're actually different courses, and we've never accepted transfer from one to the other. So you probably have to do them over, but we have to think about that. But Senna, you can send me an email if you'd like, okay? And then Suzanne says, yes, the website gets updated on the application deadline. We have quite a few applications right now, over 60. So it will close early. I don't think we're going to extend it or anything like that. What location or branch do we choose? Cherry, what do you mean by that? Can you respond to that a little bit more? When you say what location or branch do we choose? And you guys can talk too, if you want to talk. Okay, I'm not hearing back from Cherry, so I will go to Sarad Ray's question. I live in Sacramento. How confident are you in placement in nearby areas? I am not confident at all. I'll end it right there. I think we had one place, I can't remember where it was, in the Sacramento area, but we don't really have placements out that far. If you know of a place and you can help us get a contract, that might work. But as I said, you have to kind of be willing to go where we can place you. Suzanne says, for a student that already has an SNM, is there a transcript review process? We do not take transfer credits. So unfortunately, it's just too complicated. The exception might be Senna's question about from our own nurse educator program, but I'm not sure about that. Any other questions? There's got to be somebody. Anybody? Christina, the deadline for fall 2024 admission, I think so. Let's say that it is, because we have so many applications right now that I can't see it going on beyond that. Okay. All right. Anybody else? So if you start your application before that date, that's good, but we've got a lot of them. Yeah. So this information is good for next year too, of course. Anybody else have questions? All right. And I never heard from Cherry about location or branch do we choose? So I don't know if you meant about the clinical sites. We kind of end up choosing those for you just based on what we can find. And then as far as what you go into after you graduate, that's kind of something, it's up to you, what your interests are and so forth. We don't provide like specialized training or anything like that. We don't do a pediatric specialization or psych specialization, anything like that. What does finding my own preceptor entail? I would just say if you happen to know somebody who's an FNP who would be willing to precept you, and you're admitted to the program, letting us know about that would be helpful. But I wouldn't start looking for somebody before you apply. That doesn't make any sense. And we do have a person that looks and finds preceptors for you. It's hard. It's hard. Do you hear of graduates ending up getting hired in their preceptorship locations? Yes. Yes, we do. It just really depends. It depends on how you show up, so to speak. What they think of you, what the place is, all of that, all of that. Your first job as an FNP can be difficult to find. It can be maybe not the job you really want. But once you get some experience under your belt, you have a lot more options open to you, I would say. What are the pass rates in the program? What do you mean passing the boards around, or do you mean failing out of the program? I'll address both questions. Failing out. No failing out. And nobody has failed out, but people do step out. And especially during the pandemic, we had more than I would like to have seen, like 3 or 4 step out of a group of 20, because you can't really be working full time and doing this program. So it becomes a lot, because people have family commitments and all of that. And so once you start doing your clinicals, it's like 2 days a week. So that's, more than some people want to tackle. The board pass rates, I don't know how it compares to other schools. It's only about 50%. And I would say it's something you need to take really seriously when you go into it and study really hard. I don't know of any program, maybe, who knows? We don't specifically prep you for the boards. That's something after you graduate, you need to study on your own some, and we can help you with some tools and referrals for places to study. And then a lot of people don't take the boards right away. They wait. And I would say the longer you wait after you graduate, the harder it gets. All right. Is that all the questions? Anybody else? Anybody else? Okay. All right. Well, again, you can email me if there's anything else. All right. Okay, everybody. It was nice to see you. Hopefully I'll see some of you in the program next year. Okay. Bye. Oh, wait. One more question. Good. As far as the structure, one more question. As far as structure, is the program front-loaded with bookwork and clinicals? Yeah, kind of. Do you remember that slide I showed you? The first year, you do the pathophysiology, the pharmacology, and the health assessment, which are kind of your harder courses. But then the second year, you still have to do nursing theory each semester, and you work on your master's project, which is some bookwork. Okay. Any other questions? Thank you, Senna. Nice to see you in this seminar. Okay. All right, y'all. I'm going to end it, and take care. Stay dry. It's going to rain again. Bye.